All right, we're just holding on and waiting a little bit for more people to join. Give me about 30 seconds here and we will get started. I do want to be respectful of your time as well. I know this is not the most interesting topic, but please know that this is a really important topic. So many people make errors and there's so much help available for you out there. So I hope this webinar will help answer all of your questions. And I have over at the side there is an ask a question button. So if there's any questions that are not answered, you're more than welcome to contact me and we will, I'll do my very best to answer your questions for you. So let's get started. Medicare can be quite confusing to some. I mean, some are experts, but I remember the first time that my manager trained me. This was back in 2008, and she trained me on Medicare, and I was like, really? What? Do people figure this stuff out on their own? I mean, A, B, C, D, Medicare deadlines, donut hole, Medigap, Medicare Advantage, supplements. I mean, penalties. There's a lot involvement in Medicare. And I see people making mistakes all the time. So don't be one of the victims who makes an error and then have to pay the price later. Out of everything that you're receiving in the mail, and I know for some of you that are turning 65, you're probably being bombarded with mail. This Medicare and You Handbook is the most important information that you have in the mail. So please read it. If you did not receive it, I provided a link over here at the side. You can download it. And if you're not able for some reason to download it or the link isn't appearing, sometimes my technology isn't the best, feel free to send me a message through Ask a Question and I will provide one for you. All right, so what are we going to cover in this webinar? Original Medicare and its four parts. What does Medicare cover? Original Medicare or Medicare Advantage. What is a Medicare supplement? What's a Medicare Advantage? Part D prescription drugs, late penalties, and important enrollment dates. Let's dive in. So your Medicare original initial enrollment period begins 3 months before your 65th birthday, the month of, and 3 months after. You can sign up for original Medicare, for A and B, I should say, at ssa.gov/Medicare, or you can go in person to a local Social Security office, or you can dial 1-800-772-1213. Now, if you are going to call, my recommendation, this is what to expect. You're first of all, you will be on a long wait on hold for a while. And then when somebody picks up the phone, they're not going to enroll you right on the spot. They're going to set an appointment for somebody to call you back. So if you are someone who procrastinated and you're in a month before you're turning 65, and you do not have other creditable coverage in place, I highly recommend that you either go in or you apply online. The quickest way is, of course, online, like everything in the world. Now, if you are already enrolled in Social Security prior to turning 65, then you will automatically be enrolled into Part A and Part B. Okay, after you have enrolled into original Medicare, then you get to decide how you want to receive your Medicare. So option one is original Medicare. You have your A, your B, you decide if you want a supplement, you decide if you want a drug plan. We'll get more into detail with this as we move forward. Or you can choose what's called a Medicare Advantage plan, also known as Part C. These are like your HMOs and PPOs that you are probably used to with an employer plan or an individual plan, whatever you may have. That includes your Part A, your Part B, and most of these plans also do have a drug plan included. So what does original Medicare Part A cover? Okay, first of all, you are eligible, or when are you eligible? You're eligible at the age of 65. There's no cost for Part A as long as you work for as long as you've worked 10 years, 40 quarters, and paid into the system. It allows you to go to any hospital nationwide that accepts Medicare. Your Medicare Part A benefits will restart after you are out of the hospital for 60 consecutive days. Now, I know that's probably confusing. I'm going to explain a little bit more about that in the next slide. Once you have used your lifetime reserve days, they will never be available again. Once again, I will explain more about that in the next slide. These are your costs with original Medicare Part A. Okay, so inpatient hospital stay for the days 1 through 60, it's a $1,600 deductible. Now, this deductible is not an annual deductible, it is a 60-day deductible. So what does that mean? If I go into the hospital on January 15th, I get out on the 17th, I go back in on February 15th, I'm still within my 60-day period, so I do not have to pay that $1,600 deductible again. However, if I'm out of that 60-day period and I go back into the hospital on April 3rd, I will have to pay the $1,600 deductible once again. If I have a long-term hospital stay, days 61 through 90, I would have to pay $400 for each day. And Medicare only covers up to 90 days, covers a 90-day hospital stay. But you also have 60-day lifetime reserve days, which those are $800 for each day that you're in. And once you've used up your reserves, they're no longer available to you. Now let's move on to Part B. Part B is you're eligible at the age of 65. It can be delayed if you are on an employer plan with creditable coverage. Standard premiums start at $164.90 a month, but it could be higher depending on your income. It can also be lower if you qualify for low income, also known as the Medicare Savings Program. Medicare Part B allows you to go to any doctor and facility that accepts Medicare nationwide. This is what Medicare Part B covers. So first of all, you would have to meet a $226 deductible. Once you've met the deductible, Medicare will pay 80% and you will pay 20%. Now, example, if you go to the doctor, you pay 20%. If you have your blood work, it's 20%, an x-ray 20%. If you have a surgery, you pay 20%. If you go to the emergency room, it's 20%. Now, some doctors and facilities do not accept Medicare assignment. They can tag on an additional 15%, which means you'd be responsible for 35%. Now, there's no maximum out-of-pocket cap for original Medicare, Part A or Part B. So that's why let's segue into why people might choose to supplement their original Medicare. You must pay, first of all, you must have A and B in order to purchase a supplement. You pay a monthly premium for your Medigap policy that is in addition to the Part B premium. A supplement does not include prescription drug coverage. Monthly premiums vary by company and type of policy. Also, rates increase as you get older. Medicare supplements have guaranteed issue. When you first turn 65 or first enroll into Medicare Part B, you do have 6 months to choose a Medicare supplement plan without answering any medical questions. After the 6 months, insurers can ask medical questions and they can decline your application if you have a pre-existing condition. Now, a side note there are other guaranteed issue rights available. I'll give you one example. If you're on an employer plan with creditable coverage and you exit, and once you exit the plan, that is a guaranteed issue right. It's not 6 months, it's 63 days from the time you leave your employer plan. That's if you have Part B in place. If you don't have Part B in place, then you have the 6 month to apply for Medicare Part B. Medicare supplements allow you a choice of doctor in hospitals. It's accepted nationwide by any doctor, hospital, or facility that accepts Medicare. And the coverage is standardized by Medicare. So Each plan is identified with the letter, and the benefits are exactly the same with each plan. So the letters identified: A, B, C, D, F, G, K, L, M, and N. This means that different companies can also charge different premiums for the same exact coverage. This is a chart of what every plan, of what every letter covers. Okay. Now, it's quite overwhelming. I'm not going to get into every one because it would be really, long. This should be available in your Medicare and You handbook. If you want this slide, just let me know. Once again, send me a message and I'll be more than happy to provide you anything that you need. I am going to go in, I'm just going to talk about the most popular, most comprehensive plan. That is Plan G. If you look at Plan G, you'll notice that it is the only plan that covers the Part B, right here, Part B excessive, the 15% that we talked about earlier. The only thing you'd be responsible to pay in a Plan G, in addition to the premium, would be the annual deductible. This year for 2023, it is $226. Please note that that is for 2023 rates. The copays do change every year, unfortunately. Now, if you have ever heard, now if you're a new beneficiary, if you'll notice, I have Plan C and F over there to the side. The reason why is because Plan F used to be the most comprehensive plan, but it's no longer offered to new Medicare beneficiaries as of January 1st of 2020. Okay. Now, in order to complete original Medicare and a supplement, you would also need to add a prescription drug plan. Prescription drug plans may have a monthly premium, an annual deductible. The deductible is usually waived for your Tier 1 and 2 drugs. Prescription drug benefits work off of a calendar year, so that's January 1st through December 31st. And plans use a formulary. This means it's a list of drugs covered by the plan. Please know that not all plans are equal. Some plans may cover drugs at different tiers. That's why it's really important to shop around for your prescription drug plan. Prescription drug benefits, again, are in tiers 1, 2, 3, 4, etc. Some drugs may require that you have a prior authorization. Prior authorization, basically, sometimes you might go to the pharmacy and they say, oh, Mrs. Jones, your drug wasn't covered, but it may just need a prior authorization. That means that your doctor or whoever prescribed the medication would have to call the plan and get it and prove that it is medically necessary, and they will pass it through the insurance company. Quantity limits. Some companies may have quantity limits on certain drugs. That means they will limit the amount of drugs they'll give you every month. You'll see this often on things such as opioids, which are drugs that are dangerous. So they'll limit the amount that they'll actually prescribe you at a time. And some insurance companies may also have what's called step therapy. This means that let's say you have an expensive drug, there are cheaper versions. They may say, hey, Mrs. Jones, we want you to try this lower cost drug first. If it doesn't work, then we will cover your more expensive drug. That is option 1, original Medicare. So let's move on to option number 2, which is Medicare Part C, also known as Medicare Advantage. Medicare Advantage combines your A, your B, and many of these plans also have your drug plan included. And they also offer additional benefits not offered by original Medicare. Medicare benefits are, so the way this works is your Medicare benefits are transferred to and are managed now by an insurance company. Now, some of these plans may require that you select a primary care physician and that you stay within a network. You may need a referral to see it. Excuse me. You may need a referral to see a specialist. Premiums may vary depending on location. Many plans offer additional benefits not offered by original Medicare. So things such as dental, vision, hearing. But you must also, in addition, you must continue to pay your Part B premium. So again, Just to sum things up, how will you receive your Medicare? You have option one, original Medicare. You have your A, your B. You decide if you want a supplement and you decide if you want a drug plan. Or you can go on to Medicare Advantage, Part C, which is again like an HMO or a PPO. Your A, your B, and your C, and your A, your B, and your D are all included in one plan. Let's talk about pros and cons because I think this is really important. Original Medicare, your pros. So, original Medicare with supplement, your pros are you have a large network, no referrals are needed, you have nationwide coverage. So that means you can see someone in California, you can see a doctor in Massachusetts or Texas or wherever you'd like to go. You have the freedom to choose any doctor that accepts Medicare or facility that accepts Medicare. Now, the cons are the monthly premiums, and premiums do increase as you age. It could get quite costly once you start to get into your later 70s, late 70s and up. Um, and also, you may be denied coverage if you do not apply during the initial, the guaranteed issue phase. The pros and cons of Medicare Advantage. So the pros are zero to low monthly premiums. You have additional benefits not covered by Medicare. They're guaranteed issues, so there's no worries about pre-existing condition. Um, and they allow you to enroll, so you can enroll into a Medicare Advantage during the annual enrollment period if you missed your initial enrollment period. Now, the cons is that you do have a restricted network. Some plans may require that you have a referral to see a specialist. And I just want to add that sometimes doctors tend to go on and off of these plans. So let's go back and remind us this time again, 3 months before your initial enrollment period again is 3 months before your birthday, the month of, and 3 months after. Now, what happens if you miss this, your if you miss your initial enrollment period and you do not have any creditable coverage in place? And then you can be slapped with a late enrollment penalty. So the Part B late enrollment penalty, for each 12-month period you delay enrollment into Part B, you may have a 10% Part D premium penalty unless you have, again, unless you have creditable coverage in place or you qualify for a Medicare savings program. That is, you would have to qualify due to low income. Part D also has a late enrollment penalty. So earlier I said you decide if you want a Part D plan. And I come across quite a few people that they don't take any drugs. And they're like, well, Julio, I don't take any drugs. Why do I need to sign up for Part D? Well, you don't have to, but if you don't and you do not have any creditable coverage in place, they will tag on an additional 1% for every month that you are uninsured when you decide to go on a plan. Sounds fair? Anyhow, let's get into two common errors that I often see with Medicare beneficiaries. COBRA is one of them. So sometimes people will retire and their company gives them this amazing COBRA rate. And they're like, well, why should I go on to Medicare? So they don't go on to their Medicare Part B. Well, COBRA is not considered creditable coverage. So what that means is when you exit your COBRA when your COBRA ends and you decide to enroll into Part B, you will be slapped with a late enrollment penalty. Same thing I see happening with individual plans, ACA plans, aka Obamacare. There are some people that are getting really great deals on these plans and they think that the Medicare rates are higher, so they avoid going on to Medicare and to find that they are not eligible. Once you are eligible for Medicare, free Medicare A, I should say, that is considered eligible. You are no longer eligible for subsidy under the ACA. So please avoid making this mistake. So what is next? Your option one, I mean, you can start calling 20 different places and navigate the system on your own to get rates and information. Or you can let me do all the heavy lifting for you with no additional cost to you. Who am I? I'm Giulio Campanelli. I born and raised in Los Angeles, California, and I still reside here. Um, I have been licensed since 2005, and I have been independent since 2014. I have helped hundreds of individuals and families enroll into health plans, and I am also licensed in several states: Arizona, California, Florida, Michigan, New Mexico, North Carolina, Oregon, and Texas. What are the benefits of working with an independent agent? Well, I have an unbiased look at over 20 insurance companies. I make sure that your doctors and prescriptions are covered. I review coverage with my clients every year if needed, and I help my clients understand their benefits and all of their Medicare options. Also, once again, there's no cost for my help. And let me just go back. People wonder there's no cost. Well, how do I get paid? I do get paid commission through the insurance company. They pay me. I don't favor any insurance company. They pay me all the same. So that's why I don't favor anyone. It's about finding the right plan for my clients. So sometimes I go the extra mile for my clients and I help them with things, um, and I help them out. And this one, I this client called me and she was just so frustrated. So I'm just going to go ahead and read the Facebook post that I put up. And I'm helping someone with a complicated Medicare issue. She was told by Social Security that she'd have to wait till next year to enroll because she missed her initial enrollment period. So just so you know, this person enrolled. She remained in she enrolled into Cobra rather than enrolling into Medicare, which caused this problem. Well, together we made a call to Social Security, and I brought up a couple reasons why she should qualify for a special enrollment. So I was able to find I was able to find a loophole there that were able to get her through. Let's just say that after our call to Social Security, this person is feeling hopeful that she will be enrolled effective 7/1 of 22. Now, she was told by Social Security it would be 7/1 of 23. Now, before we hung up, she said, "I can't see you through the phone line, but do you have wings?" Well, excuse me. That brought a smile to my face and reminded me why I love what I do. Now, these are some of the comments that I got from my post. Monica, you have no idea how much you helped me by switching health plans this year. It saved me thousands, and I have been able to get all the care I needed. I have ambulatory surgery tomorrow, of which my coinsurance is $520 instead of $3,000. Thank you for all you do for your people. Julie, you are truly great at what you do because you make people feel heard, cared for, and then you always go into take charge mode. You're very good at it. And Grace, it's so true. You've helped me many times. So from this point, I hope that you have enjoyed this presentation and this has helped clarify some things. If you need a replay of it, please let me know. I'll be happy to send you a link. Or if you would like to schedule a time to see me, I have a couple ways of getting a hold of me. You can schedule an appointment, and or you can click on permission to contact where I would call you, or you can give me a call, or you can just exit out. Anyways, I hope you enjoyed this presentation, and thank you for taking the time.